Hello everyone, welcome to my channel. So in this video we are going to see about the Noora Health business module Canva. Noora Health, it is a non-profit organization. This mainly focuses on training caregivers inside the hospital, and this helps the patient to recover better at home. For example, a patient is discharged after the surgery, and often depends upon or depends entirely on the family members for the care. And the main problem is caregiver don't know the proper care techniques, and this leads to infection and other complication. For example, we can say a caregiver may not know about, or they don't know how to clean the wound properly, and which will leads to the infection and readmission of a patient in a hospital. And coming to the customer segments, it is patient, family caregiver, hospital. Coming to the example of this, it could be a mother caring for a newborn, or an elderly parent caring for a diabetic patient. Coming to value proportion, it will be simple and practical training for caregivers, and which will also help to reduce the hospital visits. And caregivers are taught how to monitor the sugar levels at the home for diabetic patient, or how to clean the wound after the surgeries, or how to take care of the diabetic wound in the home. So these are all will be taught to the caregivers. And coming to the next segment, channel, it is group training sessions in hospital will be conducted, and videos and visual aids will be provided for the caregivers or whoever the beneficiaries are. And for example, nurses use charts and videos to teach the baby care to the newborn mothers before the discharge. So these are the main things will be explained to the beneficiaries. The beneficiaries could be whoever the needed. Here, for example, we have took newborn mother, how to take care of the child, and for example, we can also take post-surgical patient after an accident, how to take care of the wound or how to position the patient. And for bedridden patients, like who are crossed the stage of coma, so how to take care of the patient, how to prevent the death. So all this will be taught in this. And customer relationship, so direct interaction and trust building, easy language communication will be there, and the trainers will explain the care steps in the local language, so family could be easily understand the process. And coming to the revenue stream, it will be grant and donations and the partnerships. For example, government hospital partners with Noora Health to run free caregiver training programs. And the main key activities will be training for the caregivers and creating the educational content, conducting a daily session on hygiene, medication, timings, nutrition, and if it is a newborn care to or class to a newborn mother, it will be based on the feeding methods and sleeping routines and the vaccination schedules up to 6 months. After the 6 months infant period, what are all the sessions we have to give, or what are all the diet should be given, will be clearly explained. And a plan chart will be also, it could be provided in this. And the main key resources and partners are trainers, hospital and non-governmental organization. For example, doctor and nurses collaborate with Noora Health trainers during the session, which will be helpful, and it gives a direct training to the beneficiaries from the doctors. Coming to cost, for staff and training materials, printing sample instruction charts and running training session, this will be the main cost for the Noora Health. And coming to the conclusion, it is a small training which will give big impact, and family become more confident in caregivers and healthcare burdens will be reduced, and a trained caregiver can prevent a complication, and they could avoid another hospital visit and saving both money and life. Thank you.